Hello and welcome. My name is Donna Cryer, and I am the founder and CEO of the Global Liver Institute, a patient-driven advocacy organization that operates in the US and Europe. I have the honor today of being your host for this episode of GLI Live, and I'm so excited about this episode and this month's series in particular because we are focusing on rare liver diseases. Shining a spotlight on conditions, patients and families and organizations that you may not have heard of before, but are doing really important work. And so if you've been following along with our hashtag RareAware, you may be aware, hopefully, but if not, hang on and stay tuned. So with me today, I have Cher Bork, who is the Executive Director of the Alagille Syndrome Alliance, and Shambhavi Ravishankar, who is an Alagille syndrome patient, a board member of the Alliance, and like me, an attorney. So always excited we can have fellow members of the bar who are using our training and education and experience to great purposes. And so hello to each of you.
Hi, Donna.
Hi.
On here today. We're excited.
Absolutely.
Thank you so much. I also want to make sure I'm giving credit to the organizers and the originators of the overall rare disease month, February, in which we sit. And this set of events that the Global Liver Institute has been organizing really would not have come to fruition without the fabulous work that the larger rare diseases community has been doing. And as we look at that intersection between rare diseases and liver diseases and come to this point of the rare liver diseases, I do want to give credit for the work that has been going on in this space of which we are proud partners. So let me start with you, Cher, just asking you to talk about what is Alagille syndrome. I have been married to a geneticist, so I know. But for those who are viewing this, please tell us about the syndrome and what work the Alliance does.
Okay, so Alagille syndrome is, of course, a rare disease, a genetic disorder that it's classified as a cholestatic liver disease, and majority of Alagille warriors do have liver involvement, anywhere from mild to severe, needing a transplant. What's unique about Alagille syndrome, though, is not just the severity of the disease, but also the variability of other organs and systems being involved. So there's a large percentage of Alagille warriors that also have a cardiac component, maybe kidneys, bone, eyes. Just about every major organ and body system might be affected by Alagille syndrome. And so, that makes not just the care of it very difficult and challenging, but also the diagnosis, because it looks like so many other conditions or diseases. So, it's really unique. And again, just the severity and the variability of it, pose some extra challenges, for our families, for sure.
That centrality of the liver impacting so many different systems is definitely a concept that is underreported and underrepresented and recognized. So I'm really glad that you discussed it in that context. So Shami, as a patient living with this condition, tell us about your experience.
So I grew up in India and I was diagnosed in India. Typically, things take a long time to get underway here. And so I think I must have been 5.5 or 6 years old when I finally got an appropriate diagnosis. And at that time, it wouldn't have even been with a genetic test to confirm that it is Alagille. It would have just been through your biopsy, through a blood test, and through looking at the other facial and skeletal markers that patients with Alagille have. So my journey has been a little uppy downy in the sense that I have pretty mild symptoms. I do have a paucity of bile ducts. I do have a cardiac component in terms of having a ventricular septal defect, a hole in the heart for lay people, and I have pulmonary stenosis, which is the thickening of the arteries leading into the lungs. And so I do have yearly checkups and cardiac consults and things. But luckily, so far, there haven't been any major surgical procedures on these two key organs. But because of, I guess, maybe not enough awareness, not enough information coming into where I live, I did have to have severe spinal surgery when I was 12. I was completely paralyzed waist down because a clot kind of formed in my neck and exploded, and I just couldn't feel anything. And I didn't know at the time that people with Alagille are prone to bleeds. No idea, no indication whatsoever. And so that was about a month and a half of rehab and intense, back and forth with the doctors to get me back on track. It meant time away from school and a lot of bribing with donuts and food. And so that was a plus point. But it was an interesting journey to really understand just how amazing the human body is and how quickly it can bounce back with the right kind of inputs. So in that sense, that's why I said it's uppy downy. There's like a good side and a bad side. And as I've gotten older, I've gotten stronger. As you rightly pointed out, I am a lawyer. I do work in a law firm in India. But as an adult, my challenges have changed. It's no longer just, the pruritus, which is itching, which comes with having a cholestatic liver disease. It's things like bone pain, muscle pain. It's things like chronic fatigue. These kind of things have a variability that really no amount of medication or even physiotherapy can regulate as to when these symptoms flare up. So it's definitely been an interesting journey, learning to accept my body for what it is and learning to understand that it's okay to have a bad day. Finding my own normal, creating your own normal is what we call it. Finding peace within that and finding happiness within that. So that's my journey, learning to love myself.
Shambhavi, that is such an important message and series of messages for any patient with chronic disease. I know a lot about the Spoonies community.
Yes.
On Twitter, that you may start with a certain number of spoons of energy for listeners who aren't aware. And some days you have 12 spoons, some days you may only have 4 spoons, and you sort of spoon it out over the course of the day, trying to pick your battles about what's more important. As everybody knows at this point, I have IBD and a liver transplant after an autoimmune liver disease, and so I very much identify with that concept. And sort of joke sometimes with my doctors. I'm like, so there's either shower or work. Some days that there's not shower and work. That's a different negotiation with myself.
Yeah.
So many patients and so many people are hard on themselves if they're not perfect, if they're not working at 100%. I do try to hang on and remember what it feels like on my best days, on those perfectly hydrated, normal hemoglobin, that. This is what it feels like, because it's very rare that I feel like that. But, still, what can we do that's of impact and import on this day with the energy that we have, and be gentle with ourselves? And you're right, love ourselves. What would you tell a friend who was saying, and treat yourself at least as well as that friend that you would reach out to.
Absolutely.
So Cher, Shambhavi, laid out an array of hurdles that a patient would go through in whether to get diagnosed or managed either in a pediatric setting or as an adult. A whole list of ologists that I'm sure are involved in this. So what type of resources? How does the Alliance help patients navigate these?
Yeah, thank you for asking that. So, we have spent the last couple of years really getting a lot of programs out there for different stakeholders in our community. And for families, I mean, one of the very main things, of course, is education. We want families to, to realize that just like Shammy, when they have something like Shammy's talking about the bleeds, they can come to us and say, is this connected to my Alagille? Could this be? And we want them to know that they're not alone. So we have so many education resources for them. We have a whole education program for families. We also, a couple of years ago, implemented a financial assistance program for families, which really, it helps them to alleviate at least just a little bit of the burden when times are the toughest. We have expanded that financial assistance program internationally also. And the international program is something that, we were talking about that earlier. That is something that we really are committed to, and we'll grow that this year. We translate our documents into many different languages, and then we have right now for the Hispanic community around the world, we have a full page on our website completely in Spanish for them. We do Zoom calls with experts for that community, and then we'll be expanding that this year into other areas of the world also. One of the programs that we have that Shammy really got started is an access program. And that access program helps with access to medication and, connections to other families, to experts. Underneath that umbrella, we also help families navigate insurance denials. There's so many ways that an organization like ours can help our families. And so we really do try to hit everything we can. Of course, we have a very robust support group online. Right now, the biggest one is on Facebook. We have several thousand people in there, but we're trying to move that to our website so we can have more of a message board on the back end of our website where about midway through the year, we will have some of the conversations on there moderated with nutrition experts, nutritionists, lots of different experts. So there's just many different things that we're trying to do to really help meet the needs of families all along the way. Shammy, am I forgetting anything that's helpful to our families?
Well, yeah, I mean, I think the biggest thing that we did in the last 1 or 2 years was the translations. Whole bunch of people from all across Europe, all across Asia. I think the best case was what we found in Egypt. I think that was an amazing story. I really hope you share it at some point here. The way that we're bringing families together and not letting language be a barrier to access information, I think that's something that we've really been able to do. But we've also been able to bring the advocacy into the whole thing of bringing in the law. Now, insurance denials is something that's very technical, very legal. Similarly, access to medication, compassionate access use programs are going to become the way of the world for people outside of the continental US or continental Europe to get access to medication. And so bringing those elements into our big group of programs is something that I'm very proud of within the Alliance. I think that focus is just amazing.
I think that's fantastic and certainly multifaceted. So you've taken on a lot. And so I'm glad that we have this opportunity to give you credit, and we have more than enough time to sort of take some of these pieces and expand on them. So I loved the fact that you are looking at best practices from around the world. In any given country, even the U.S., rare disease patients may be spread very, very far apart, and it may look like only a few. But when you look at any rare disease globally, then the numbers start increasing, and so I think that it's certainly one of the impetus behind the creation of our Pediatric and Rare Liver Diseases Council, to make sure that every pediatric and rare liver disease organization can scale globally and can reach out and realize the full potential of its community. And you all have done such a great job at that. So, you know, I want people to know about that and learn from that. So, you know, borrowing best practices from Egypt, making sure that your materials in as many languages as possible, so that's not a barrier. Let me ask you a question just on that point of sort of reach and language. So, what type of physician treats Alagille syndrome, and you know, how you connect with them and make sure that they have the tools to talk to their patients, you know, in these various languages, or reach out and provide, you know, culturally competent materials, you know, to them.
Right. You know, Donna, you are well aware that, you know, families themselves become the best advocate for themselves, for their kids, and, you know, just getting information in the family's hands where they can then take it to all of their different specialists, you know, really been kind of a great way to get in front of, you know, physicians or clinicians that may not know about Alagille syndrome. And I mean, it's something that we all face in the rare disease community, you know, educating clinicians and physicians. You know, that is a challenge that, you know, we try to overcome, you know, in various ways, but honestly, just the families being able to take that material straight to their doctors has really been helpful. You know, we do have a new opportunity to speak to some residents at some different hospital institutions here in the U.S., and maybe that is a starting point or a new jumping off point for, you know, physician education. One of the things that that has been the most beneficial internationally, we do surveys of our families. We conduct, you know, probably, I don't know, 2 to 3 major surveys a year with our family. And, you know, we try to have those surveys translated. What we find is, you know, even though it's still Alagille syndrome, in various the world, people are dealing with different challenges than they are here in the US. And so just trying to navigate, you know, those additional challenges in different areas, you know, we need surveys, you know, so we have the patient voice. That is, as you know, so important. I mean, that's why we're here today. And those surveys drive, I mean, they drive everything we do, from our program development. Survey results make up the content for our roundtable meetings that we have with our stakeholders, where we bring together, you know, families and science and pharma and clinicians all together at the same table. You know, the content for those meetings is derived right from our surveys. So I would definitely encourage not just families to take them, but also other organizations that might be listening, you know, maybe try to find a way to implement those. It's so important. You think you know your community, and you do, but to see it in black and white, really impactful, and has helped us, you know, with all of our relationships. You know, we can use that information, you know, for science and research and just it's just, surveys are so important to our organization.
I absolutely agree with you, and I give you, you know, kudos, because I often ask the question, how do you demonstrate as a patient advocacy organization that you are yourself patient-centric? Before we ask stakeholders to be patient-centered, we need to demonstrate ourselves and make sure that we are looking across the diversity of our patients, across, you know, depending on the condition. Do you make sure that you have representativeness from, you know, pediatric and adult populations, from different age, you know, racial and ethnic groups, from different types of geographies, from different, you know, resource backgrounds? So you're absolutely right that should inform, you know, our direction and program as organizations, and certainly also improves our credibility as we reach out to regulators or policymakers and, you know, and others. So with that, I'll leap over to Shami because she's shaking her head. And so, you know, good data and a good story make for very powerful arguments in advocacy. And so I want to talk to you a little bit more about, you know, advocacy, and dig deeper into the types of issues that you're helping your families with in Alagille syndrome, with insurance and the maybe particular types of financial needs and concerns that they have.
So, I mean, I'll build off of what Cher said with the surveys and with the kind of discussion that we have on our Facebook groups. I think we have about 13 or 14 groups across the world, including one from my own country. And the discussions that take place there, the way people share interesting tidbits of the way they cope with their, with their child or their individual diseases, it's so important to encourage that. It's so important to let families have that platform to come together. Like I can share my personal advocacy journey began that way. It began with stumbling upon the Alagille Syndrome Alliance's group on Facebook. I'm sitting 3,000 miles away, and finding people who are going through the same things as me, finding adults going through the same things as me, it opens up a world of possibilities. So we start with that. We start with encouraging this kind of discourse, and if we see something that's truly alarming, if a parent or a patient has posted something, we often reach out to them and ask them, could you tell us a little bit more about this? This is concerning. One or two examples I can give you on that is bone pain. And the psychological impact of living with a rare disease, the medical trauma that kids and adults with Alagille go through. And these are two things that we started noticing on our Facebook groups. And from that, we decided, and this I give full credit to Cher for. I mean, she said, we need to put this into a survey. We need to find out how many people are living with this. I mean, this is insane. And so we started to get more information, and not just yes or no type questions. We asked for quotes. We asked for anecdotal evidence of what did they go through when they went to tell a doctor that I'm in pain. Those kind of really deep and often painful things to share. But when you get that kind of insight, you can build on that and let doctors know. Like, we were able to have a roundtable discussion on bone pain, and doctors were there, pharma was there, and I think this was maybe the first or the second time where it was presented to them as such a challenge for the community, and they really stood up and took notice. So it filters in from knowing and having a pulse of what your community is going through anywhere in the world, to then feeding that into a survey and just getting real hard evidence of what is going on, building that into discussion with your stakeholders, and then beyond that. And so I think we've been able to do that largely because of that focus.
I think that's fantastic. And on the issue of bone pain and particularly types of amorphous pains or so often women's pain is recognized and treated. Pain from people of color reporting it is under-recognized and mistreated. And for GI, hepatology, renal patients, the options for us may be limited in terms of treatment, and some things that are a little harder to get or less frequently prescribed these days may actually be safer options, for us than we can't take NSAIDs, so I have that conversation. I can't take NSAIDs, and so I think that making sure that patients know they're not the only ones reporting these things, collectively presenting them to physicians and medical societies, and coming to common solutions of what treatment options are actually being made available to patients is so important to provide that heft of the organization and our aggregate numbers and experience, so that the individual in that one-on-one power dynamic with the physician, being told that it's all in their mind, or they should just take this, it's so important, to have there are folks who lose months and years of their life and productivity to pain that is undertreated. So, even that one part, and I, Cher, you laid out a constellation of things from eye issues, to cardiac issues, hematology issues, Shami, that you've been through with clotting, but each one of these unpacked and supported by your organization in data, and translated into education and assistance in the policy, and really pulled all the way through and sort of wrapped around the patient in a very holistic way is so powerful. Is so powerful for people.
Yeah, and we hope that, especially the bone pain, it's something that, like Shami said, we saw it and we knew about it, but to now have, so much data about it, no research right now on bone pain. And so, we're hoping that, that this data will spark that for a scientist somewhere who says, wow, I really think I can impact this. It's just, there's so many things that you can do with the survey results. I mean, they are incredibly important for every aspect of what we do. And so if there are any families listening, definitely take the time, to answer those when you see them. We have a couple coming out this month. It's interesting what you were just talking about, Donna. One of the surveys we will put out this month is about disparities. And, that is critically important right now. So really hope that that other organizations too, will maybe be inspired by some of the work that we do to impact their own communities. Our latest survey results, we've just made those public recently, and they're on our webpage under our resources tab. And so, we love collaboration. And anytime there's another organization that that maybe wants to talk through some things, or like I said, be inspired by some of the work that we do or some of the stories like Shami's, we love collaborating. So hope that they'll reach out to us for sure.
Thank you, and we'll make sure that your email address is in the show notes so that people can follow you and connect to you on Facebook and on your website. And on that note of collaboration, we so appreciate you joining us in the Pediatric and Rare Liver Diseases Council, and I know also that we share interest in support for the Black Women's Health Imperative, Rare Disease Diversity Coalition, and the work that they're doing. We're stronger together. While we each have our individual initiatives and work, moving forward together and figuring out how we can solve common problems most efficiently, so that our strained resources can be put towards those unique problems. I think is something that we don't do enough of often in the nonprofit space, and we can do more of. I was writing recently on sort of trust, building trust in the nonprofit space, and you have to first be trustworthy, and there's sometimes you have to really think about what's in the best interest of the field as a whole. And can we advance that, as well as certainly we always have the interests of our own organizations, but if we're really here for the patients, if we're really here for the families and the communities, sometimes you have to take a step back and be disciplined and think about, let me give this so that the entire field moves forward, and that's that's often hard, but it's something that's really, really important to me. Building trust amongst organizations and being trustworthy, and having GLI certainly be a trustworthy partner and platform. That at the end of the day, what is said about us is that we've lifted everyone a little bit higher.
We thank you for what you're doing. We're excited to be, a part of this, a part of the council. We thank you for, for providing this platform, for organizations like ours to come on and, educate the world about our disease. We are so appreciative of that.
Fantastic. So, I know you have even more fantastic things coming up. You have a fantastic symposium. So I want you to be able to talk about that before we leave, and then I'm going to go around and ask for a message that you want to leave for people. But tell us about your symposium, because it's your 9th year, so you must be doing something right that people keep coming back to it again and again. So
Right. I'll give you some specifics about the event, and then I would love for Shami to kind of,
Okay.
tell why it's so important, for the families to attend. It is the 9th International Symposium. When we are in person, every other year, when we're in person, we do have a full scientific meeting along with that, kind of in conjunction. At our last symposium, which was in 2019. That's the first time that we also had this roundtable meeting that we've talked about today. We have since done that virtually, but that is an amazing opportunity. We had the scientific meeting and then family symposium, and right in the middle, we kind of bring everyone together, use those survey results for content. We came up with, I don't remember, Shami, maybe 8 questions that we posed to the group, and each table got a couple of questions, and at each table we had all of our stakeholders represented. So we had a family, at least one family. We had one physician, clinician, researcher, pharmaceutical representative, and just this open discussion about a specific challenge. And then at the end of the day, representative from the table, Shami, of course, came up and said, hey, here's what we decided at our table is a possible solution to this challenge. And it was incredible. Not just what came out of it, but the families to sit there with, especially, leaders of pharmaceutical companies who were, emotional and invested. That so far with our families, to just the synergy that we had, and it was very emotional, but we came away with great, like I said, some opportunities to solve some challenges, different partnerships that came out of that, collaborations. It was incredible. This year, of course, is going to look a little bit different because we are going to be virtual, as I think so many people are. But like we talked about earlier, that opens up the possibility for families all over the world to be engaged in the event. Typically, when it's an in-person event, we offer travel scholarships, but this is just, there are families that even with a scholarship wouldn't be able to travel, for various reasons. This allows so much more engagement and interaction from around the world. We have a very big couple of days planned. We're kind of known for our agendas being packed today. So we have 2 full days planned, and just really, really excited about that. That's going to be in July 15th and 16th. And really excited. We're going to be using the My City Med platform, which is really exciting. It kind of looks like you're walking right into a for real conference. So we're excited about that. And Shami, I would love for you to just, talk about how important that is for families and what it means to our families to be involved in those symposia.
Well, oftentimes it's the first time that you have met someone else who's in a similar situation to you. Like it's the first time there's a kid next to you who's itching as much as you. So that kind of normalcy and that sense of community is invaluable. Like you really can't put a price tag on it. But more than that, it's also a chance for parents to meet with adult warriors. It's a chance for parents to meet each other and, commiserate, learn, celebrate. It's a human experience more than anything else. But I have to say, also, it is so important for researchers to meet us. They're dealing with cells in a lab and with images that are glowing. It's so important for them to be able to put a face on something that they're researching. It gives them motivation. It gives them so much more strength of renewed vigor to continue researching, because often you spend decades in a lab and you don't really get any tangible results, and it's easy to feel demotivated. And so I think that's another sort of selling point of attending a symposium like this, because it's an immense human connection all around.
So I'm going to ask a very human question. Lest it fill up the comment section. What do you do for your paritis? I know it's not, you're not giving medical advice. It's not a universal answer, but everybody's going to ask. Well, I'll ask before it fills up the comment sections.
No, so for me, my pruritus is pretty much under control. It just flares up really badly during my PMS, which is like right before my menstrual cycle and during. On days that it's really bad, I am on some medication. I won't say what because I don't want it to be medical advice, but I do kind of temper that in. But when it's really bad, cold showers are very helpful. Cooling down the room, sleeping in as minimal clothing as possible, so that more surfaces don't, aggravate and itch the skin even more. And I think the other thing that I found is really soothing creams and oils like these neem is a kind of herb that's available here in India. So those kind of creams, they're very helpful to soothe the itching, to soothe the aggravated area. Also aloe vera gel, very, very helpful. Yeah, so that's another thing that I try in a sore spot. But my most favorite thing, and I wish I had it with me, but it's like a yarn. It's like a piece of yarn that I twirl when it gets really bad, just to keep my hands busy so that I don't end up itching and bleeding all over the place. I wish I had it with me, but it's like soft cotton, and you just kind of twirl it and keep your mind and hands busy so that you don't scratch all over.
That's fantastic. I call those pro patient tips.
Yes.
I'm 30 some years from my first diagnosis and 26 years post transplant, and so talking with new patients about it's those things that often in the doctor's office that don't get addressed, but if you talk to experienced patients, they'll give you this.
Yeah.
This is what I actually do to make it through my day. So I just wanted to make sure that that patient wisdom here, all the other wisdom that you shared with me. So, as we close this out, Cher, what do you want people to know about Alagille syndrome?
Before I answer that, I do want to go back to the paritis real quick, and just this is something that everyone to know. So Roberta Smith, our president, who couldn't be here with us today, she talks about the very best piece of advice that she ever received when her daughter was very young, and it was about itch. And the advice is never tell them not to scratch. Let them scratch. Let them go through that, because if you try to keep them from scratching, then the alternative is to turn to other things that harmful. So, just for the families that might be listening, okay, let them scratch. And just, we don't want that to ever say not to scratch. So I just kind of wanted to get that out there since we were talking about paritis. I think I want the most for families to know that they're not alone. Find a support system. The Alliance is here. We are always here. Roberta and I, Shami, the other board members, we talk to families 24 hours a day, because
absolutely.
a family, if they are on the other side of the world and they need us, we are here. So, we would love to be the support system, but, find your support group, find others that are just like you. And, if you can find them through the Alliance, we would love that. Let us help connect you with other families. Let us help connect you with, the right information so you can get the right care for yourself and your child.
Fantastic. So, Cher, Shami, thank you so much for being part of this episode. Thank you so much for the work that you do and all that you bring to this. I really cannot thank you enough.
Oh, thank you again.
Thank you so much, Donna.
You're very welcome. And to everyone listening, thank you for being a part of this episode. Continue to send us your questions, your show ideas. Join us next week at the same time on Facebook. You can find this episode and others on the Global Liver Institute.org website and across several platforms. Please stay safe, stay connected. Until next time, bye-bye. Thank you.
Thanks, Donna.
Bye-bye.